Communication skills. Basic communication skills. Significance of communication. Communication is to communicate and share ideas, feelings, etc. between each other. It is necessary to learn communication skills as a method to establish a good relationship of trust with other party. How communication goes. For example, the nurse, you look very happy today. Sending a message to the user. Yes, very much so actually. And then sending in the other side. Sending message to the nurse. Methods of communication. The methods of communication consist of verbal communication, in which language is positively used, and nonverbal communication, in which gesture and facial expression other than language are also used. Number 1, verbal communication. Verbal communication is made through conversation by speech and sign language, and through letters and characters. For example, communication, we have speech, we have sign language, and letters and characters. Number 2, nonverbal communication. So nonverbal communication is made through hands and body gestures and facial expression. For example, like nodding, and then like showing your emotion, showing your smile. Number 3, communication skills. Be aware of the following to establish relationship. Listen attentively. Attentive listening implies listening to the speaker carefully, correctly, and eagerly, showing it in your attitude. So, when the user is talking to the nurse should carefully and attentively and eagerly show an attitudes toward the user in communicating that the nurse is carefully listening to the user. Be empathetic. Empathy. Empathy implies sharing others' opinions and feelings. It is important to try and understand things from the other party's standpoint. Okay. And then we have accepting. Acceptance implies accepting the other party's opinion and feelings without denying and admitting them. Number 2, communication with user. Technique of listening, technique of positive listening. Care worker communicate with the user, their family members, and other specialists to support the better life of the user. Respect of user values. Each user has his/her own values used on the time and environment he or she live in. The care worker provide nursing care, respecting feelings, thoughts, ideas, and values of the user. Number 2, points to remember regarding verbal communication. Wording. Care worker keep in mind to use polite wording. Good morning. Technique of asking question. Care worker should not keep asking question to the user to get all the necessary information. Again, the care worker should not keep asking the question to the user to get all the necessary information. Instead, they should try to establish mutual communication with the user. There are number 1, closed question and open questions. Number 1, closed question. Closed questions refers to a question that elicits a word response from the other party such as yes or no, A or B. Communication becomes one side if you keep asking a closed question. Number 2, open question. So, open question refers to question that lets the party answer freely, such as what do you think and how do you want to do it. Please note, this is the kind of open question. However, that the other party may think that she or he is blamed if you keep asking why to determine reasons. Example of questions. Do you like curry or rice? This is a sample of a closed question. And the user answered, yes, I do. This is the sample of open question. What is your favorite food? Well, let me see. Repeating. Okay, the coworker can give the user a message that I am listening by repeating what the user said. This is repeating. Example of repeating. I had aches everywhere last night and could not sleep. So you could not sleep because of all those aches, body aches. Points to remember regarding nonverbal communication. The gesture and facial expression. The care worker observes the gesture and facial expression of the user and communicates with him or her based on observation. The gesture and the care worker observed the gesture and facial expression of the user's and communicates with his or her based on her observation. Eye contact. The care worker established eye contact on the same level with the user. It is because it is difficult for the user to know that the care worker is listening if there is no eye contact. How do you establish eye contact to the same level? Eye contact on the same level should be same. If the user is in the wheelchair, you have to sit down. The user will find intimidating if the care worker look down on the user. Yeah, so the user will feel intimidated if the care worker looks down at the user. Okay. Tone. Talk to the user in a slow, soft tone of voice using appropriately in between, nodding and agreeing, moving the head up and down to nod and agree with the user, saying, I quite agree, will show the attitude of listening carefully to what the user says. Posture, hands, and body gestures. The care worker communicates face-to-face with the user. If you cross your arms or legs or lean back in a chair while you listen to someone, it will give a bad impression to the person. What hands the body gesture mean significantly differ depend on countries and culture. What hands body gesture means significantly different depending on countries and culture. Points to remember regarding posture. Speak face to face, eye level. Do not cross arms. Do not cross legs. And do not lean in a chair. Do not lean your back on the chair while listening. Okay? Distance touching. In some countries, speaking with each other, maintaining a short distance in between and touching each other will help develop a sense of affinity. In Japan, however, it is said that many people feel more comfortable when a certain distance is maintained even between close friends. The content of the message sent by touching someone will be interpreted by recipients in a variety of ways based on the timing, intensity, and frequency. Example of touching: hold the hand softly and talk. Explain the consent, explanation and consent, informed consent. The care worker provides support for the user decisions making so that he or she can live his or her usual life. When providing such support, the care worker should keep the following points in mind. Number 1, present options. Number 2, carefully explain the advantages and disadvantages of each option when the user decide his or her own will. In order for the decision of the user be realized, the care worker should respect the option and provide support. Number 2, communication suitable for the state of the user. There are times when it is difficult for the user to communicate with others due to diseases and disabilities. It is important for the care worker to choose appropriate communication methods based on the user's disease and disabilities. Importance of communication suitable for the characteristics of various disabilities. Communication is sometimes hindered by disease and disabilities. The care worker works to identify the hindrance to establish communication suitable for the user. In recent years, the use of ICT, information communication technology, is a method of communication has become increasingly popular. Number 2, communication with person with visual impairment. Characteristics of communication with a person with visual impairment. Visual impairment is a disease in which the person is unable to see things or has difficulty seeing things. As a person cannot get enough information from visual perception, there are times when he or she does not know the distance between him or herself and various things and place he or she is in. 2. Points to remember when communicating with a person with visual impairment. Use the information that can be obtained other than from visual perception, explanation, specifically in detail and the location and characteristic of things, etc. Moreover, it is important to be aware of the tone of your voice and the way you talk. You can also provide information by letting the person directly touch things. Call the person by name and talk to her or him. If the care worker touches the users with or without, he or she will surprise. Be sure to first talk to him or her. When you talk to the user, call the person by name first. First of all, it is important that the care worker announces him or herself. Call the person by the name and talk to him or her. Mr. X, do you drop something? When you talk to the person with a visual impairment, make it clear to whom you are talking. Specifically explain the location and direction. When you explain the location, be specific. For example, tell the person to your right and to the direction. My voice is coming from. When the person is having a meal and you need to tell him or her where the specific dish location, you can explain it direction by mentioning the direction to which the hour, hand, and the clock is pointing at a certain time of the day. This method is called clock position. Example for the methods of the tools of support to use communicating with person with visual impairment. Use of a tool of support to suit the condition of user with visual impairment will make it easier to communicate with him or her. Example of methods and tools of support to use communicating with person with visual impairment. Braille, 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 Braille. Braille and Braille blocks are available as tools for communicating information with people who are blind. So we have Braille and Braille blocks. Communication with a person with a hearing disorder. Characteristic of communication with person with hearing disorders, such as a person cannot hear sounds well. He or she tends to have a sense of loss and isolation, which makes it unnecessary to provide psychological support as well. Points to remember when communicating with person with hearing disorder. Face and talk to him or her so that each other facial expression and mouth movement are visible. If one of his or her ear is less impaired, talk from that side of the ear. Talk slowly and clearly. Do not talk unnecessarily loudly. Converse with him or her in a quiet place as possible. Example of the methods and tools of support to use in communicating with a person with hearing disorder. Speech lip reading. Speech lip reading refers to seeing and interpreting lip movement for communication. Conversation through lip reading. Example: good morning. Conversation by means of writing. Conversation by means of writing. Communicate with a person using paper. Write and erase board, etc. ICT and others are also used for such communication. So the ICT. Sign language. So conversation by means of writing. So that is the conversation by means of writing. Now we go to the sign language. Sign language refers to the expression of meaning using combination of finger, hands, gesture, and face and neck movements. Conversation using sign language. Next, we have hearing aid. Conversation using hearing aid. The hearing aid is a tool that collects sounds with microphone and amplifies and delivers them to the ears. Communication with a person with aphasia. Characteristic of communication with a person with aphasia. Aphasia is a state in which a person functions to listen, to understand others, to read and understand documents, to speak and to write characters and letters, declines due to damage to the part of cerebrum that controls speech. So there's a damage in cerebrum that controls speech is aphasia. Points to remember when communicating with a person with aphasia. Talk to the person slowly, clearly, and using short and easy understand words. Use communication methods other than speech, including pictures, photos, hand and body gesture. Do not point out minor speech errors. Ask close questions so that he or she can answer easily with yes or no. For example, of methods, use methods and tools of support to use communicating with person with aphasia. Use of hands and body gesture instead of speech. Use pictures and illustration. Communication with the persons with dementia. Characteristic of communication with a person with dementia. Due to the decline in the cognitive function of the brain, there are occasions when the same conversation is repeated in the number of times and the conversation between the care worker and the user just does not make sense. Characteristic of communication with a person with dementia due to decline of cognitive function of the brain. The occasion when a same conversation is repeated a number of times and the conversation between the care worker and the user just does not make sense. Points to remember when communicating with a person with dementia. Talk slowly. Communicate with easy to understand words and short sentences. Even if he or she talks is factually incorrect, do not deny it. Just accept it and sympathize with him or her. Example of communication with a person with dementia. Accept the anxiety of a person with dementia. Number 3, communication with team members. Basic understanding of sharing of information by keeping records. Number 1, purpose of sharing information. Nursing care provided not by care workers only, but in cooperation with medical and other staff in a team. The team members share the contents of nursing care and medical information in order to provide the user with better nursing care service. Methods of sharing information. Information sharing by keeping records, care plans, care records, handover, note, books, etc. Information sharing by holding a meeting conversation. There are meetings including handover meeting where information on the user is handed over the next shift and meeting where the staff discuss the theme regarding nursing care. Sharing of information by keeping records. Sharing of information with the next shift. Significance of keeping records in nursing care. In order to provide a good quality nursing care, it is necessary for the care worker to grasp the information on the user. The care worker records the condition of the user, approaches made to the user and his or her response to them. Keep records is significant from to perspective, provision of better care service, and implementation of team care. Basic of keeping records of nursing care. Keep records while your memory is fresh and clear. Number 2. Record the date and time accurately. Record the date to make it possible to know when the recorded incident happened. Number 3. Record facts. Facts can be classified into subjective and objective facts. We have facts, subjective and objective facts. Subjective facts details what the user saw, what he or she experienced, what he or she complained about, remarks of the user. Objective facts. What the care worker, etc. observed. Blood pressure value, body temperature, examination data, etc. Objective. So what they observed. Subjective. What the user saw, what he or she experienced or complained. So, subjective yung complaint, objective yung observation. Example of record. We have the date, for example, July 20, 2019, and we have the objective fact, which is the observation. So, the details are found redness 1 centimeter in diameter on the sacrum area of Mr. X when I provide the toilet assistant at 8 a.m. So this is subjective. The 8 a.m. and found the redness like 1 centimeter. So this is what you observe. That is objective. I asked him and he said he was not feeling any pain. So that is subjective. What is the complaint? That's the subjective. So he was not feeling any pain, according to Mr. X. I reported the fact to the nurse and it was identified as an early stage of pressure ulcer. Alright, so we go to the record information in manner that enables readers to understand and the contents just by reading it once. So clearly, record 6 items as follow. When, where, who, what, why, and how. This is record information in manner that enables readers to understand the content just by reading it once. Clearly record the 6 items as follows. When, where, who, what, why, how. So, 5W1H. 5W1H. Example of an easy to understand sentence. When, on Monday, who, Mr. A, why, pick up what, a first. Where, in Tokyo Station. Why? So we went to the police box. So we went. How? We went to the police box. Number 4, protection of personal information and maintaining a confidentiality. Care worker must pay careful attention to information management, protection of personal information, and maintaining of confidentiality in particular are strictly required as part of professional ethics of specialist Professional ethics of a specialist. For the sharing of personal information, it is necessary to obtain consent from the user, him or her, regarding the handling of personal information, etc. Types of personal information. We have the name, address, phone number, photo, the concerned individual is in, etc. You need to pay attention to the following to protect personal information. Do not talk about users and your workplace outside your workplace. Do not post comments on internet SNS about the users and your workplace. Reporting, communicating, consulting. Reporting, communicating. Care worker provide nursing care in a team. Therefore, they report to and communicate with other team members that what they have noticed in the interactions with users and progress of their own tasks and others for sharing information. The timing of reporting and communicating differs depending on the contents. If the contents require immediate response, such as an accident, report it right away without delay. Person providing information. Report it concisely. Report the facts and the opinions separately. Report information by taking the place and timing into consideration. Person receiving information. Take notes, listen, and distinguish facts from opinions. Repeat what the other party has said. Number 2, consulting. When you have trouble or there is something you do not understand, seek advice from colleagues, specialists. Do not make a judgment by yourself when you have worries. Consult others to get advice. That is consulting.